newly installed Secretary of the Board of Directors and President of Community Health of South Florida here in Miami. I've been part of my organization for over 15 years and coming to NAC meetings for just as long. And I look forward to hearing from the members of the NAC team today as they talk about their vision for the future. And to kick us off, it's my pleasure to introduce NAC's President and CEO, Mr. Tom Van Coverden, with welcoming remarks. Tom?
Thank you very much, my friend. We are so fortunate to have you now on our executive committee, and I cannot say enough about all the work you are doing and the staff and our friends and the people in South Florida. And now opening up your newest site all the way to Key West, it really is incredible. So the first thing I want to do is say thank you and encourage the rest of our staff as you get to Florida to make sure you see all the way from South Miami down to the Keys. What an incredible job they're doing. Blake, thank you. As I stop and think back, this has really been quite an incredible year, yet once again for all of our community health centers, for NAC and for the NAC staff and members and our partners, all of our partners. So the first thing starts out is just to, I think, give thanks to everybody and for all that you've been doing throughout the year to help people. We started out with COVID-19 with the year. Then again, the battle to make sure we had enough supplies to go around for all of the health centers when and where they needed them, for reimbursement, for telehealth, and outreach with transportation to get the vaccinations, and then finally making sure that we actually did it, administered the shots, and were able to report back on a weekly basis to the White House directly. So a lot of credit to all of the teams. I want to say thank you to your staffs, to our staff, our NAC staff, to our officers and board. We could not be doing it without your strong, strong support and encouragement, and you've been there for us every step of the way. And our entire team, which includes the primary care associations, the health center networks, and all of those are supporters that have really done a job providing additional financial support and materials for the health centers, whether it's getting through wildfires up in California, all the way to the hurricanes and the floods of the recent tornado. God bless you all for a great job, and I want to say thank you so very, very much. Blake, back to you, my friend.
Thank you, Tom. I now have the pleasure of introducing about 15 members of the NAC team, and I will introduce them in order from newest to longest serving member of NAC. And that time span ranges from about 3 months to a little over 22 years. And it's really great to see the newest team members that are also longtime health center leaders who are serving as mentors and sharing their knowledge with staff who are newer in their careers. So without further ado, let's get started. I want to introduce to you Dr. Wanda Montalvo, Senior Fellow and Team Lead, Public Health Integration and Innovation. Jaron Phillip, Deputy Director, Federal and State Policy. Dila Davis, Deputy Director, Federal Affairs. Letitia Harley, Manager, Business Processes and Special Projects. Eureka De La Cruz, Program Manager, Social Drivers of Health. Rachel Gonzalez Hanson, Senior Vice President, Western Operations. Jeremy Crandall, Director, Federal and State Policy. Dr. Julia Skapik, Director, Medical Informatics. Camila Silva, Deputy Director, Innovation. Ellen Robinson, Director, Information Resources and Outreach. Ted Henson, Director, Health Center Growth and Development. Jennifer Nolte, Director, PCA and Network Relations. Amy Simmons, AVP, Media Relations. Danny Hawkins, Senior Vice President, Community Health Ventures. Jason Patnosh, AVP of Development and Innovation. And as our team comes onto the screen, I want you to imagine just for a minute, imagine that you're a fly on the wall or just listening into a phone conversation of NACs and their interdepartmental meeting to discuss the future of NAC and how they can support the health center movement.
Thank you, Blake, and congratulations on joining the NAC Executive Committee recently. Let us bring our meeting to a start here today. I've had the honor of having the most offices and titles for NAC over the years among my peers today, but definitely do not come with the most experience or the freshest ideas necessarily. I continue to be in awe of NAC's progress and footprint in the health center community and see NAC and the health center model as a way for primary care going forward in the future. As I could say, in my 22 years at NAC, I can remember walking into the NAC offices on New Hampshire Avenue as an intern and having only about 40 colleagues on staff. And today to just, look at it that we are spread across multiple offices and close to 120 staff amazes me every day. It's been a joy to work with many of these colleagues over the decades at NAC and have the opportunity to actually learn from a lot of the leaders. It's been an interesting spot to sit in, having one part of me, part of a generation that founded the health center movement, and another part of me that's helping to shape the future of the health center movement. And to have those dynamics play out every day has been a blessing. Over the years, and especially the last 2 years with COVID, I think health centers are realizing the role that we will play in the future as primary care for much of America. We are seeing that we are bringing equity to the healthcare space and recognizing that we can shape a workforce that is representative of the patients we serve and the communities we're in, and also that is there as a team to support their communities. I am looking forward to, our conversation. This meeting today will take just about an hour and wrap up by 3. But I want to look, to my other members of the, what I'm coining the 20-year club at NAC, and Amy and Danny. I'm wondering how your time at NAC and within the health center movement has helped to shape your thinking for the future and the role you'll play. Amy?
Thank you, Jason, and it's a pleasure to be an old timer with you, hitting the 20-year mark. When I was reflecting on this, because when I first started at NAC in 2002, or thereabouts, the patient population was a fraction of what it is now. I was the first communications director at NAC. It was a first the position that was created, and I came there from Capitol Hill. And I remember it was really hard to get even the small little newsletter to write about this small little federal health program. And over the course of time, though, several remarkable things happened, and I feel so fortunate to have seen them. One of them is that George Bush became president and sort of threw health centers on the national stage and pledged to double the number of health centers' patient population before he left office, which he did. Then President Obama was elected and passed the Affordable Care Act and promised that not only would people get healthcare coverage, but they would also have a place to go with that insurance card. And this was remarkable in the sense that it was 2 successive presidents from 2 opposite political parties who are talking about the value of community health centers. And of course, the other transformative moment is the one we're experiencing now, something that humanity is really experiencing now, and that health centers have met this moment. And we're not only change makers in healthcare in meeting this moment, but what we are learning now as we do this is what humanity is learning, and that the inequities in healthcare have been glaringly exposed and cause minority populations to suffer disproportionately from higher rates of infection and death. And I guess for me, what it boils down to is how the world has changed around us in a blink of an eye because of this pandemic. And as a person who does communications at NAC, it's been I feel so fortunate to bear witness to seeing how health centers have met this moment and will continue to meet this moment. And I feel changed by it, and I know all of you must as well, even from the new to the old. So I turn now to my other colleague who is an old timer with me. Danny, what are your thoughts?
Thanks, Amy, and thank you, Jason, for those words. I remember a lot of the same things and share the same sentiments. I would simply add that I know my commitment and that of my colleagues has never been stronger today than it's ever been. And tomorrow it's going to be stronger than it is today. You know, in my time working with and for health centers, first at a PCA, second at George Washington University's Healthcare Policy Center, and then more recently in the past 20 years with Community Health Ventures, there's one common denominator that I've seen about health centers through that time. It's that things never stay static. They're constantly changing. For example, in the early to mid 90s, it was the Medicaid 1115 waiver fights. Medicaid was changing from fee for service to capitated care or payment models. And what it did is it introduced new competitors into the market, new competitors that were going after those paying patients. Soon after that, cost-based reimbursement gave way to prospective payment models. And then more recently, value-based payment models, which has forced the transition and emphasizes health centers going from providers of last resort to providers of first choice. So change is inevitable, but health centers have been able to adapt to that change. They don't just survive, they thrive. Never once in that time, ever losing sight of their mission to care for their patients, their communities, the citizens who are often the least represented and whose voices need amplification. And I think that's what I want to do for the next 15, 20 years, if NAC and health centers will have me, is to continue to support them in this work so that they continue to thrive in terms of organizational health, but also in their commitment to mission. Now, Jen, I know you actually came from managed care. You probably remember a lot of those times with the Medicaid 1115 waivers. What brought you to NAC? And what has stuck out for you that's really shaped your outlook in thinking about the health center movement?
Thanks, Danny. Yes, an opportunity brought me to NAC. I was not looking for a new job, but this one was one that I just could not pass up. In my 7.5 years at NAC, I've always said a bad day at NAC is better than the best day at any of the 3 managed care plans that I worked at for almost 20 years. My first week was like many of us on the panel here and in the audience, but my first week was during the 2014 Policy and Issues Forum. And I've attended conferences in my previous jobs before working for NAC, but I was just amazed at how the 2,000 people in the conference actually knew one another and their families and their histories. And it just felt like a family. And what has stuck out for me from my first week and just continues to shape my outlook on the health center movement has been the passion, the commitment, and the true conviction that everyone has for those that we serve. And not only the people at NAC, but the primary care associations, the networks, the National Training and Technical Assistance Partners, the health centers, our federal partners, such as the Bureau of Primary Health Care and the Bureau of Health Workforce, and of course, all the communities that we serve. And I could go on and on. There is also a deep respect for the collective work that we all do day in and day out. And success is not built overnight, nor is it built on fads. It is built on this passion and hard work of something that is part of each and every one of us, something that's actually bigger than each and every one of us. And we've built a strong foundation. And we've been able to lay many strong layers and continue to add those layers over time. One of the things is that we actually are able to take a step back. And when we have either a small crack in our foundation, or it begins to erode, we actually make sure that we strengthen and we take a step back to strengthen and reinforce it, because we know that it's what sets us apart from the rest and will continue to move us forward. So Ted, you and I have been here for about the same amount of time. So I want to ask you, how has your time at NAC and with the movement helped to shape your thinking for the future, and what role you will play?
Thanks, Jen. It's hard to believe we both started over 7 years ago. I remember that first P&I back in 2014 as well. through my time at NAC, I've been able to work on an incredible diversity of issues, and that has only deepened my perspective and really my belief and commitment to the mission of the health center movement. Prior to NAC, my background was in homelessness and journalism. I co-founded a newspaper for the homeless street sense in DC. And I also worked in public health and worked at 2 community health centers up in Boston. And those experiences are really pivotal to bringing me to NAC at 2014 to do work on a Robert Wood Johnson Foundation grant on outreach and enrollment. So what Amy was mentioning is such a pivotal moment, and health centers were really standing at the forefront of making sure people had access to the gains in coverage that the ACA made possible through Medicaid expansion and advanced premium tax credits in the marketplace and the new exchanges. So it was a really exciting time. And then after kind of working on that for a year and a half, I was able to work with new health centers that came online. Remember back in 2015, Amy mentioned some of the big expansions and funding. We had over 100 new health centers, 330 funded health centers come online. So I got to work with those organizations as they became health centers and really sort of part of the family, the health center, the program and movement. And then since then, I've worked with other special models of health centers like lookalikes, which don't receive the 330 grant, but that do really critical work in their communities and making sure they had access to some of the funding that came out during COVID. And then also, for me, just being able to still work with like the Healthcare for the Homeless Committee, which I staff, and more recently on a CDC project with the Clinical Affairs Division on vaccine ambassadors. And so I think making sure each of these different, even though they seem really different and diverse, these opportunities, what we learn from that and from our members and the people doing the work in the field day to day, being able to elevate that, with senior leadership at NAC, with federal agencies. I know a lot of us enjoy those relationships we have, like with CMS or HRSA. And so making sure we're the voice for the people at the field. And then also, I love working, partnering with other organizations, other national organizations like the National Association of Community City Health Officials and the National Healthcare for the Homeless Council. I think those are really valuable partnerships in making sure we leverage our opportunity together to really impact population health. And so Ellen, as someone else who's worked kind of in that 7-year time span and worked in clinical during that time, how has NAC shaped your thinking towards the future?
Thanks, Ted. Yeah, I spent the first 20 years of my career on the other side, so to speak. I was working with government-funded patient health education programs, and we'd create these materials and send them out to the field and then wonder why they weren't being used. Then, fast forward, and now, having been at NAC 6 years, I totally understand there's no one size fits all, and I really value that every community is different, and we create materials for each community. Oh, I've really found that in my time here, NAC is the place where people who are interested in improving the health of underserved communities and vulnerable populations can go for information and consultation. And I was kind of reflecting on, well, what am I doing? What do I do? And I was thinking, I kind of feel like I'm the go-to person so that I can help the care team get those resources as easily as possible. And I also thought, well, I'm kind of part storyteller, and wanting to tell those stories of the patients, who are, of course, the most important member of our care teams, the board members, our clinicians, and the administrative team, and really highlight that village. I mean, I'm totally in awe of the stories about the work health centers do to improve the health of the communities they serve. Last year, I was fortunate enough during our Year of the Nurse to interview and write weekly stories about the 29,000 health center nurses and nurse practitioners. And I loved those stories. And I hope we can continue to share those stories to the field so people can see how great health centers are. We know it. We just want to make sure everyone else knows it. And I love connecting. I really see my role as connecting. And one of my many New Year's resolutions is to connect even more with the field and to help share those great stories. So if you guys want to email me, I'm going to put my email in the chat. We can set up a time to talk, either in person at an upcoming NAC conference or virtually, or, a picture's worth 1,000 words. If talking isn't your cup of tea, please send in your photos as well so we can continue to promote our great health center workforce.
Thanks, Ellen. It is really refreshing to hear all of the thoughts and ideas. And working with this team was one of the reasons I chose to join NAC when the opportunity presented. Many of you know I was the CEO of a health center in Uvalde, Texas for many years. And I was very active in the Texas Association and in NAC, including having the honor of serving as NAC's board chair in 1998. Knowing what it is like to be a single parent whose children did not have access to health care, to help build a health center from the ground up, to understand the value of being engaged, fully engaged in the health center movement, and to realize that relationships are at the heart of everything. All these experiences serve to prepare me for today. I believe that my role is to help support the transition from the first 50 years to the next 50 years, to support people like all of you who are the future of NAC, and then to step back and watch the organization grow to new heights.
Thank you, Rachel. If you don't mind, I would love to jump in and share how my time at NAC has shaped my outlook of the future of community health center. So I actually started as an outsider. I had no idea about community health centers or NAC, and that was not a topic talked about in my network. And my network is also an immigrant network. So as COVID hit, it became so much more interesting and people wanted to know more about community health centers. People needed to visit community health centers. So I think the future of the movement is one that many more people know about it, and not only know about it, but that the nation recognize the unique role that the health centers play for all of us. So I think that that's really going to be the role of NAC in the future, really making sure we lift up the voices from the field, because I do think that is going to translate into more partnerships, more engagement, external engagement, and more innovation. And in terms of the role I hope to play is one that bridges the gap of looking to the future, but also honoring the history and the background of all the work we have done all these years. So, Jaren, I know you have been at NAC for less than a year, so I wonder what brought you to NAC and what has stuck in what shaped your outlook on the community health center movement.
Well, thanks, Camilla. I've had a lot of different jobs, still early in my career. I work for federal government. I work with state Medicaid agency. I even work for a local county mental health agency in Flint, Michigan. And you know what? I have to say, it's the people who brought me to NAC. From when Kelly and Jeremy first recruited me to any given meeting on any given day since, I just know that I'm working with folks who are truly emotionally invested in this work. People here want to lift each other up and to support each other. And that's really what shaped my outlook on the movement too. I think, like what you said, Camilla, we're here to lift up and serve the patients who have nowhere else to go. And I can't really think of a better place to lead from. Wanda, I know we've been at NAC for about the same amount of time, but you come from many years in the field. What are your thoughts?
Well, I was kind of always been connected with NAC, whether I worked in the front lines in a health center, and often followed what was going on by looking at what NAC put out and what was affecting us in the front line. And so I think coming to NAC, now that we have this kind of real great opportunity, I'm going to build on what Rachel said, which is, what is the generational opportunity? And that's the type of impact that we can make. And with forwarding NAC's strategic plan, looking at, two pillars that really kind of resonate with me as part of our strategy is looking at centering equity and social justice. When you think about the movement of health centers, how diverse we are across communities in this country. Hola, mi gente. And also, I think developing the mission-driven workforce of the future are great opportunities. And coming in as a senior fellow with kind of diverse experience, along with Dr. Jenny McLaurin and Dr. Grace Wong, it's a great time to be at NAC. And I agree that I think our kind of focus is how do we grow? How do we support? How do we align our strategy with policies and be opportunistic and to engage, more federal agencies and philanthropy in the work that we're doing? So in many ways, I think that's a, great question and a great opportunity. So I'm gonna, punt over to Delia.
Thank you, Wanda. Thank you for sharing. You know, I joined NAC about a year ago. In the middle of COVID, I drove across from Chicago. I had worked at a community health center in Chicago for nearly 16 years, Access Community Health Network, and I led the fundraising and government affairs efforts there. And I joined NAC because I was looking for an opportunity to really influence healthcare and to create access for underserved communities at a national level. And so when the opportunity presented itself, it was just a perfect alignment. And so I'm invested in the health center mission simply because it's a good work. I think all of us can go someplace and do something. But when I say community health centers are a good work, I mean that with a capital G in good and a capital W in work. We improve the lives of patients in our communities every day. And it's the simplest things of making sure that a grandfather is healthy and has affordable medication so he can pick up his grandkids from school and he's helping his daughter out. Or a child has access to care to manage her asthma, or a family can receive fresh groceries because they live in a food desert. So, you know, health centers and their staffs are saving lives and uplifting souls, and one patient at a time. And I'm happy to promote and share all of the health center's good work with our elected officials. So I want to throw this over to Letitia. I don't think we've met in person, but you also started around the beginning of COVID. And why did you join that?
Hi, Delia. Hi, everyone. Yes, thank you for asking me that. And you must have been reading my mind because I was thinking the same thing as you. I love the question, why NAC? I think it's easier for us to say why me, but it's harder for us to say why you. And so when I look back and reflect on my almost 2 years, a fast 2 years I've been at NAC, I joined the organization because I thought it was a perfect opportunity for me to align my passion for project management, my skills in project management, with doing work that makes a difference. I think sometimes as a project manager, we can be very technical, but this opportunity with NAC just allowed me to really do work that matter, and I didn't have to sacrifice, and I can be a part of something greater than myself, and something that really made a difference. Similar to Jaren, my background varied. I've had federal experience, and I've also had experience working on the grassroots level. And so NAC allowed me to do that, with that perfect place where I was close enough to the pulse of the work, where I felt the impact, and I was a part of the impact, but yet far enough to see the national implications, as well as the strategic opportunities to create some differences across our nation. I'm personally passionate for health equity, and so it's just been an amazing 2 years, and I'm thankful for having an opportunity to join NAC, and look forward to utilizing this opportunity to create a major difference in the world. And with that, I'm going to pass it over to my colleague in PPR, Jeremy.
Thanks, Letitia. And I swear there's more to me than just my head and shoulders here. So the answer for me for how I made my way to NAC is really quite simple. I'd been familiar with health centers from the very beginning of my career. Interestingly enough, my very first boss in public policy worked at NAC in the very same position that I have now, which is super weird. But really what lit a spark in me was a former job that I had that was about expanding access to dental care for underserved communities. And it took me to about a dozen health centers across the Commonwealth of Massachusetts. When you step into a health center, it's inspiring, it's energizing. It reminded me selfishly why I personally love doing this work. Anyone paying attention right now to where we are as a nation know we are surrounded by inequity, not just in healthcare, but across the societal spectrum. While that is frustrating and at times incredibly demoralizing, stepping into a health center really enables us to see the possibilities for progress. I truly believe that. You can see it in the faces of the clinicians and the staff who are fiercely committed to our patients. You can see a future of healthcare that prioritizes whole person health and wellness. One of the images that sticks in my mind when I was thinking about this question more than most is when I was lucky enough to visit a health center in downtown Boston. During the tour, I saw on each floor, as we were going through, right by the door to the stairs for this 10-story building, was a chart that showed what type of care and services were available on each floor. first floor, pharmacy, second floor, pediatrics, third floor, dental, fourth floor, behavioral health. I won't go through all 10, but that image really encompasses to me what health centers are all about. That type of commitment to all-encompassing primary care really does not exist anywhere else in healthcare. And really at a core level, it's why I think we are going to be at the forefront of the future of healthcare in this nation. So next, we're going to go to Julia Skapik. Julia, not only have you been at NACC the last few years, but you've also been on the front lines in the clinics during the COVID pandemic. For you, how have these experiences shaped your thinking towards the future?
Thanks, Jeremy. Yeah, so I'm really pleased to come to NACC. I spent a long time working in the federal government and some time working in industry. And while I really appreciate the value of being at a high level, one thing that I learned very early on and was repeatedly reinforced is how important it is to hear the stories of the people who are on the ground, both the patients and the care teams. And I repeatedly tried to reinforce that at my time in the federal government. And so it was so valuable to start working directly with the health centers that are fighting the pandemic and that are fighting the challenges that we experience trying to provide high quality primary care to patients who traditionally experience a lot of health disparities and a lot of social challenges that affect their ability to achieve the optimal level of wellness. One thing that I think is really valuable about the pandemic is that it highlighted this problem of the last mile. And I think that if anything, health centers are basically the consummate experts in figuring out those last mile challenges. They take what they're handed and they figure out how to make it work. And I think the rest of the industry is really realizing what the value is of that. And it's not just the last mile of the medical challenges, it's also the last mile of the social challenges of physically reaching patients, of getting the services that they need. And I'm really proud as a primary care provider at Neighborhood Health of Virginia to be doing some of that on a daily basis. I really think the other thing I see for the future is, as we've done a rapid transition to telehealth, we're realizing that we don't just want to provide traditional in-person services over the phone or over video. We can really change the way we provide care and let all the members of the care team work at the optimal level of their expertise to reach out to the community wherever they are and to really incorporate that into the way that we provide care and help people achieve better outcomes. And I think there's no better time to pass it over to my colleague, Eurico de la Cruz. And when we're talking about social determinants of health, the informatics team has been working closely with the research team to try and understand how do we move Prepare, which has really been a national leader in understanding social challenges and social drivers of health, and push that into our electronic health records, push it into our billing systems, and make that part of the regular way we provide care. Eurico, you want to pick it up?
Thanks, Julia. And yes, it's been great working with you on Prepare. And now that Prepare has kind of transitioned over to the Public Health Priorities Division, we're really excited to see how it's going to continue to expand and grow. And so really when I started at NACC was right at the beginning of the pandemic. And it was just interesting to see how the pandemic brought the social drivers of health front and center. And we witnessed their impact on structurally marginalized communities. And when I think about the why I joined NACC, it's really all of that. I've always wanted to be part of national efforts to improve the social determinants of health, primarily because I grew up in poverty and I grew up without health insurance. And this lived experience really shaped my passion and dedication to improving health equity. I also worked as a community health worker in the beginning of my career, and I've had several roles throughout social services at nonprofits and community-based organizations, as well as traveling through the healthcare landscape. And I've always worked with health centers, and I worked at a health center. And I must say I have a really, I have a soft spot for health centers. So based on my personal and professional experience, I've always connected family and friends that don't have insurance to health centers. And so I've learned so much when I worked at a health center. I've worked with an incredible interdisciplinary team where we worked with patients that had complex medical conditions, and we did home visits. And it was just amazing to see the magic that happened when we all worked together. And so I'm really grateful that not only do I get to support health centers, but that I can share the amazing work that they're doing, especially around advancing health equity. So for me right now, it's been great to hear everyone's story as to how they got to NACC. And I really just want to think about, now that we've learned how we've all got to NAC and why we're passionate about working here, how we're going to move forward to the next 50 years, as Rachel mentioned early on. So for me, I think one of the things that I'm really passionate about is really thinking about how do health centers play a role in advancing local and state policy that can disrupt health inequities. The health disparities that we see in our communities is really the result of policies and systems that create poverty, that create these injustices. So, you know, how do we work backwards? And what's great is that with this commitment, not just of the SUH team here at NAC, but really NAC's overall commitment to social justice and racial justice that Dr. Montalvo mentioned earlier, and thinking about what NAC can do to support health centers, it can be done in two different ways. And one of them is to leverage SDOH data, hopefully using Prepare, but if not, we'll help health centers use SDOH data to really take that data and make the connections to the health disparities that we see, to make those connections to the policies in the system. So again, we can work backwards and disrupt these systems. And then I think the second thing is to intentionally prioritize individuals with lived experience. So either here at NAC or at health centers, really think about who are the people that have the lived experience, and how can we center their voices and efforts to advance health equity. So it could be board members, it can be staff, it can be health center leadership, because really people that are closest to the pain have the solutions and the ideas that are most meaningful. So that's kind of what I'm thinking for the future of NAC.
Wow, Eureka, how do you follow that? That is a true vision for the future of NAC, and I'll do my best to add my 2 cents. What I'd like to see continue at NAC, in partnership with health centers and other shareholders, is to do our best to support the work in helping health centers develop strategies that promote their organizational health, improved clinical outcomes, efficiencies, enhanced productivity, and greater patient-provider satisfaction, all while at the same time promoting the health center mission. And there is a way that these two things can be properly connected to one another, but to do it in a way that makes them interdependent upon one another, making sure that each part is necessary for the other part to be successful. And I believe it's our job, whether it be through the data that Eureka talks about, promoting equity in health, and doing it in a manner that helps each health center determine what it is that connects those two things together, so that organizational health and the mission of health centers are connected. Ted, what are your thoughts?
Yeah, thank you, Danny. I think that's a really great point, and I would just second that health centers really we should double down on our mission. I also think recognizing, as you said previously, that we are in a marketplace where we have competitors. I remember back in 2019, Jason and I were in some conversations around innovations, and a leader from Chicago made a comment that health centers need to be careful about not becoming the next Blockbuster if we don't innovate. And that was pre-COVID. And so for the FOM IT conference that year, we brought in a keynote speaker who was a futurist, who talked all about the upcoming accelerating technological and digital innovation and the new age. And so it was all around personalized, data-driven precision medicine. And I remember at the time we got some feedback from people at the conference like, oh, this is really inspiring, but we're not quite there yet. Flash forward and a couple months and COVID put us there, and we're doing virtual visits and really revolutionizing the way we provide care. So going back to just your comment, I think, grounding our work in equity in our mission, I would say from my vantage point at NAC too, similar to what Eureka said, I think addressing social determinants of health, really recognizing that they're political drivers of health and that there are policy solutions to a lot of them. We have to be bold when we talk about that. But I really would encourage health centers to fully invest in their enabling services staff. We've seen incredible investments under the Biden administration in community health workers and navigators and outreach and enrollment workforce, other health care extenders. This workforce addresses the non-clinical issues that dramatically impact health. they also are the eyes and the ears for health centers with respect to what's happening in their communities beyond the walls of the clinic. And I think the value of this workforce has long been underappreciated and not quantified. So now I'm committed to help sort of raising that profile. And as health centers contemplate a future beyond the fee for service reimbursement, not just value-based pay, but really whole person care, as I was alluded to before, this workforce needs to be a part of that conversation. So those are my thoughts. But I'd love to hear from Dr. Montalvo, who I know you worked as a nurse at a health center in Brooklyn, in addition to a variety of other really interesting experiences with PCAs and foundations. So what are your thoughts?
So it's funny, as I'm listening, Yuriko, and to you, Ted, and others on this, I keep thinking of this African proverb that says that as the music changes, so does the dance. And that's where we are. This music, we're going from salsa to, merengue, to all types of rhythms with this pandemic. It's crazy how we've had to kind of adjust. And so as a nurse researcher, one of the things that I would say that is I started with very humble beginnings. So Yuriko, I started as a secretary at a health center. And so I think that, health centers, when we think of a mission-driven workforce, the prime pipeline are our own staff in our health centers. And when we think of what are the opportunities, Ted, to your point, that we really are an interwoven network. And I view the work that we do as almost like a blanket that protects people. And as people that are committed, that we're also staunch advocates, like a dog with a bone, we're not going to let it go. We want to influence policy. But with that comes the opportunity to use, strategies that are informed by research. But NAC and the health centers and the data that we have really are the ones who operationalize that and say, this is how it's done. This is what we need. These are the gaps. These are the policies that are getting in the way. And what are the opportunities to move that? So even when we think now of the pandemic and the incredible tsunami of challenges that have come before us, if we're looking towards this, clinical workforce of the future, and Ted, I want to continue to bring forward what you said, this kind of care model around the person, we have to think about the policies that get in the way. We have to remove scope of practice barriers to nurses and nurse practitioners, advanced practice nurses. Our health centers have a great opportunity to help create a pipeline with LPNs and other people that work for us. So I want to put that, front and center, because we look at things that get in the way. And right now, like maybe 16 states really have practice barriers that impact nurse practitioners and impact physician assistants and pharmacists and other members of the care team. And so when we think of what are the demands that are going to come forward in public health, health centers played a real crucial role in filling those gaps. So that integration of public health and community health, coming side by side and partnering to meet the needs in these communities is going to be a crucial strategy that I think is going to be informed by our membership and your voice and the advocacy and how we move that work forward. And when I think of the reliable pillars on which we're building upon, social determinants of health, and we talk a lot about diversity, equity, and inclusion, and I want to reverse that we need to think of inclusion, equity, and diversity. And if you're really about commitment about that, then I look at what does my C-suite leadership look like, and what does my board representation look like? Are we representing our communities? And so those are really great, I think, components. And when the other that I think about often is, someone that leverages research to inform strategy is, where is it that we can leverage some of that? And, John Hopkins' report recently came out with an integration of primary care and public health, and where are the opportunities for improvement? The National Academies of Science, Engineering, and Medicine, as far as their implementation of high quality primary care, and the Future of Nursing 2020-2030 report. So as a senior fellow working within NAC with my colleagues, I think that it's about leveraging what we're listening and learning from the field and helping to move those strategies forward. And so I'm going to punt over to my colleague, Julia, to take on the next components.
I think, Wanda, those are so many great insights. And I think, I sort of alluded to it the first round, but I'll reinforce the importance of having everyone in the care team operate at the, the maximum part of their capacity. And when I think about what are some of the solutions to dealing with burnout and helping people to broaden their skills and become truly multidisciplinary and bring all of their skill sets to bear to benefit our patients, that includes, giving them leadership roles in creating solutions. One of the things I've seen a lot is, while the government's often well-intentioned, they don't have the insight into what's going on in the ground to build solutions that really work for those people in the field. And so what we should do is lift those people in the field up and let them have ownership of what those solutions look like. At NAC and the informatics team, we use human-centered design and user-centered design approaches to ask our partners, what solutions do you need? Not, here's a solution, we want to give it to you. We want to understand what are the challenges facing people in the field and what do they perceive as the best ways to overcome those barriers and challenges. Technology really should reinforce the solutions that are designed by people on the ground and not overwhelm people on the ground's ability to create their own solutions. So we need to really give that ownership back to people, help our, even our community health workers to design those solutions. They work hand in hand. People like Ted work hand in hand with our partners on the ground, our patients on the ground, and they should say, what are the needs that we keep hearing about? What do the patients say is acceptable to them? What really resonates with them? And there's not going to be one solution, but we need to allow excellent solutions to flourish, and we need to really scale those solutions and share them so that we get the benefit of all of the rich interactions and the passion all of our health centers have for the work that they do in the field. And I know I'm supposed to pass it next to Delia, and I think hopefully I've set her up well to talk about what at the federal affairs level we can do to bring those solutions from the ground all the way up and benefit the whole nation. So Delia?
Well, thank you, Julia and Wanda. Those are just great points that you made. And, when I think about what the health center of the future could look like, I'm thinking about it from my perspective of being on the ground. And I see health centers as much more than medical homes, but as wellness campuses. There is a book by a gentleman by the name of Tom Rapp that talks about the 5 essential components of well-being. And so when I think about well-being, I'm thinking about wellness campuses run by community health centers that are not only filled with a host of services, but also meeting the need, not only the medical need, but supporting activities that improve our patients' everyday life. Physical well-being could be managing diabetes, but also creating a space on the health center wellness campus for exercise and walking paths, cooking classes, and a fresh food mart. Social well-being at the health center, of course, after COVID, could encompass gatherings for our seniors so that they can come together and play bridge or quilt together or play cards. And that actually happened at one of the health centers that I was at in Chicago. They took over the second floor on Saturdays and they played cards, and it was their gathering space because they had no place to go. And that also addresses social isolation and fosters a sense of community and belonging. The Health Center Wellness Campus can be a safe haven for students to meet for Girl Scouts, or children to gather maybe on a playground on the campus because their community is plagued by violence, or the playground is run down, or there is just simply glass on the ground. And the Health Center Wellbeing Campus has learning labs to teach household budgeting, to provide new job training and career skills, a space to host parent or caregiver child dances. But most importantly, the Health Center Wellbeing Campus is a community anchor, a place where you can go and where everyone, like the old sitcom Cheers would say, I want to go where everybody knows your name and they're always glad you came. So by addressing these elements of well-being and using data, to design these campuses and programs, we can see our patients become healthier, happier, and live more productive, fulfilling lives. In this way, I see health centers are turning communities into gardens of Eden. That's my vision. So, Jennifer, I'm wondering at the PCA network relations level, how do you see health centers evolving and needing to evolve over the next 10 years?
Thanks, Delia. Health centers, primary care associations, and health center controlled networks will continue being at the quote unquote table and actually leading the way for how primary care is delivered and paid for, especially on a more equitable level. I see a shift in how care is accessed, delivered, and reimbursed in 10 years, and health centers will be leading that charge. It is no mistake that the health center movement is the largest primary care network today and has been able to turn on a dime to respond and provide key resources to the communities in times of this pandemic over the last 2 years. We've been actually preparing for this for the last 50 plus years. NACHC's vision of preserving, stabilizing, and expanding health centers' capacity through the 6 strategic pillars are the items that we will use to actually build and focus upon. The next 10 years is going to be a pivotal time for health centers, and the 6 pillars are those foundational items. In 10 years, I see deepened collaboration across NACHC, the PCAs, health center controlled networks, and our other partners. And just to name a few, the CDC, CMS, HHS, HRSA, health plans, and even employers. A common thread and key to what has brought us to where we are today in shaping the health centers is relationships at all levels, local, county, state, regional, and national. Leveraging and deepening both new and existing are key to where we are in the next 10 years. At NACHC, we are all responsible to develop relationships with the new leaders of PCAs, networks, and health centers, but recognizing those who have been part of the longevity and history and identifying the keys to being able to continue that success and progress the health centers have had. We want to understand the changing workforce and ability to be flexible and drive that change, which is such a huge part of this in 10 years. We need to provide the history of the movement and how that connects to today as well as to the future and why that matters and why that makes a difference. Regardless of the year or generation, it will be what drives and keeps us all evolving over the next 10, 20, and 50 years. So I know we only have a few minutes left, so perhaps we can share some rapid fire ideas on how we, like NACHC, can evolve to help health centers.
Hi, Jennifer. I would love to kick this off. And I think we are in an ever-changing world, whether we're talking about healthcare or we're talking just about our general environment. So I think the role that we as NACHC can play in helping health centers, it's really looking for those roads that have not yet been built, those pathways that don't yet exist. So in startup, we say that the first one is the person that envisions the road going to somewhere where no road exists. So I think that that is really going to be our role, not only for ourselves, but really also using human-centered design to empower the health center staff to be able to look at those roads. And while we're at it, why do they have to be roads? Why they cannot be ramps? And really think about new ways. And I think that that really will be how we as staff and we as NACHC can really look into the future and becoming catalysts for change.
That's great, Camilla. And this is Jeremy. I'm going to jump in real quick. One of the main thoughts I have is how do we utilize our best assets, patient-centered, whole-person healthcare, affordable, high-quality care to respond to what I think is a highly evolving healthcare economy. I might be imagining this. I'd love to ask the 20-year club this, but I remember a line at some point about health centers being the nation's best kept secret. I think that no longer applies given how much trust was put in health centers to deliver the vaccine and respond to the pandemic. But what I'm both excited and concerned about is how we take advantage of that opportunity. At a time when more and more consumers are looking for the most timely and easy way to access care, when we have behemoths like CVS and Walmart looking to expand their footprint in healthcare. I thought Ted's take about Blockbuster was a great point. I just think it's imperative that we continue to focus on how health centers can continue to innovate and keep serving our patients effectively.
I think there's an
Hi.
opportunity to also, to your point, Jeremy, which is amplifying what we do, and that requires communication. Using various now pathways to communication. Ted, your thing about Blockbuster, when you think about all the various pathways to raise awareness of what we do as health centers and advocacy, engaging our patients to understand what their voice is and matters, is critical. And I will say that, you know, one of the other things I think is really important is for us to learn from industries that are doing that type of work and how is it applicable to our population, and considering, you know, e-health literacy and health literacy levels are other kind of components that we need to remain mindful about.
Thank you for the response. I'm going to step in just for a little bit and talk about how I envision the future for NAC. And so what I love about NAC is even just sitting on this call, the different ideas that everyone has for the future. And for me, with my project management background, with my background, I really feel like we all have, I look at the same North Star, but have different lens. So for me, I want to kind of piggyback on what Rachel said earlier, and it's about the next 50 years. And so I want us to think about, and all the work that we do, the leaders of tomorrow's tomorrow. So our CEOs, our COOs of 2035, and thinking about what they need today to be successful in their roles later on. And this came from following CHI when I thought about I'm in the TNT department, but what does TNTA look like in 15 years? How do we be, as Camilla said, the catalyst of change in terms of training technical assistance? And so one of the things that I would like to do and what I'm going to be committed to do is create space and time in my work schedule to really sit back and strategically think about the leadership of tomorrow and try to see how we can support them and look at technology as a way to embrace and inform of what our future work environments are going to look like. Because I guarantee you 20 years ago, we wasn't thinking we'll be able to have meetings and trainings virtually. So that is all I have to say, and I'll pass it on to Ellen.
So I know we don't have a lot of time, so I'm just going to echo and use another analogy of a book, Malcolm Gladwell's book, The Tipping Point. And he talks about three kinds of people there. And I really think that when push comes to shove, NAC's role in the future and the future of the health center movement is using our nearly 120 staff to be those kind of the qualities that he mentions, the connectors, the people who know everyone, the networkers, the mavens, those who possess information and expertise and share it. And then the salesmen and women who have their positive energy and it's contagious all around. And I think if we can use all three of those and share all the great information, then we can continue to shout from the rooftops, from Capitol Hill to the Rocky Mountains. Then we'll be in good shape. Amy, what are you thinking?
Well, I really love the ideas that have come out of this conversation and the vision of my colleagues, the wellness campuses, the other ideas. And I think, you know, that's a great sign that how we've evolved. I mean, in the middle of a global crisis, right? I mean, NAC is evolving because we've had to, but the way we have shaped ourselves to meet the current and future needs, I think is really remarkable. I mean, look at us, we're all making decisions, not even sitting in the same room with each other. We're collaborating, we're talking to each other, to health centers. You know, earlier when I was talking, I was remembering how when I first became communications director that I couldn't get even a small little newsletter to write about our program. Well, last week, you know, me and a couple of staffers were speaking to Time Magazine about the needs of health centers because the Biden administration had been really responsive in terms of making sure that health centers were compensated for talking to parents about the vaccines by Medicaid, which was a real win for us. But that shows you the world, the administration is paying attention to what health centers need, the tools they need to walk the last mile of this pandemic. So I'm very optimistic that we can continue to scan the horizon and look at the policy barriers to talk to each other and help community health centers evolve as a movement to meet future needs. Thank you. And Jaron, you know, I think that as one of the newest leaders at NAC, It would be great for you to wrap this up and talk about how NAC will or should evolve in their role to help the health center movement.
Thanks, Amy. When I think about that question, I believe NAC thrives when we prepare the movement to lead on all of today's biggest healthcare challenges. If we help health centers achieve greater equity for patients, if we can rebalance the entire system toward primary care, if we can make care affordable and effective for the people who have the least amount of money, that's when we know we're evolving in the right direction. And that's how we know we've lifted up the entire movement. So here's the next 50 years, and I'll turn things over to Rachel to close us out.
Thanks, Jaron. NACC started the 50th anniversary webinars at the beginning of the year to share the work and the reach of health centers, to recognize how much health centers have done, not only during COVID, but for the last 5 decades. We heard from leaders in the White House, HHS, Veterans Affairs, the EPA, Direct Relief, foundations, members of Congress, health center staff, and board leaders, and last month, even the Surgeon General. It is fitting that we heard from our NAC team on this, our last webinar of 2021, as we look to the future. NAC has embarked on many strategic conversations over the past year, including charting our strategic pillars and bringing us back to the roots of social justice that we were founded on. And it is important for us to hear from you as well. In the chat, you will see a link. Alyssa's been really great about putting it in there. Tell us your plans. How are you going to help shape the future of the health center movement and the future of NAC? We will look at these and incorporate them into our work going forward. You know, it is also fitting to remember that we stand on the shoulders of so many health center movement founders and champions. They held firm and sacrificed when facing immense obstacles. The foundation they built led to NAC's growth beyond expectation over these last 50 years. And yet, there's still a lot of work to do. Today, NAC is honored to be the national organization that represents the voices of nearly 30 million patients, 12,000 community and consumer board members, over 250,000 staff, and 14,000 community health center sites. And this is only possible because of your support, a united support throughout the years. The future of NAC and the health center movement is in the hands of leaders like those we heard from today and you in the audience. And it definitely sounds like we were all excited for the promise of the next 50 years. Just as a reminder, if you want to hear all of the past webinars, you can visit our website and click on the 50th anniversary section on the scrolling homepage. And a special appreciation to the webinar series team, Alyssa Foley, Sherry Giles, Ben Money, Jason Patnosh, Meryl Press, Sarah Rittner, and Alexandra Walker. We could not have been a better team on this project. You could not have been a better team on this project to work with. Thank you for attending today's discussion. We wish you a happy and healthy new year.